I'm Dr. Murray Clarke, the founder and owner of ChildLife Essentials. My background is a holistic and naturopathic pediatrician for the past 30 years in Los Angeles. And out of that experience is where ChildLife grew. That's how ChildLife was born. And what I found most important in my clinical practice is what I brought to the ChildLife supplement line. 40 years ago in America, 1 in 50 children suffered from some type of ongoing chronic health problem, meaning they had to be under the care of a doctor taking medication ongoing. 1 in 50 40 years ago. Today we've gone to 1 in 5. So from 1 in 50 to 1 in 5 over the space of 40 years, the alarm bell should start ringing for us all to understand why, what's happened, what do we need to protect children more these days, what do we need to provide so that they don't become a casualty of that. So this is where we start looking at those naturopathic principles where 1, keep the body clean, 2, provide everything that it needs to grow and develop properly, all the essential nutrients, the micronutrients, and 3, how do we keep that gut healthy, where the immune system's based and where the brain is based. So that 2 most important nutrients for the gut are obviously the probiotics, the special probiotics that for infants and children. And then colostrum is the other nutrient that we can use to support not just the microbiome, but also the immune system.
So children are unique. They're a very vulnerable population. When they're first born, their immune systems are immature, and they need to be exposed to pathogens in the environment to learn and build their own immune system. And the gut microbiome helps them develop immune factors and learn how to assess environmental factors and determine what's harmful and what isn't harmful.
So how do we start? How do we establish that sort of foundation of health from the very, very beginning? Number 1, obviously, starts with the mother, ideally during pregnancy, ideally before conception, where the mother can be taking, a great prenatal, extra vitamin D, extra vitamin C, and especially the omega-3 fatty acid, DHA. These are the real critical building blocks for a mother that she can supplement with. When the baby's born, even the American Academy of Pediatrics these days recommends that every baby born in America should start vitamin D supplementation from the moment of birth, generally 400 to 600 IUs. So vitamin D3 is the first supplement not only should be given, but definitely should be given. But ideally, if the mother is breastfeeding, then really the mother can be taking the nutrients, the supplements for the baby until they start on solid foods around 6 or 7 months. So we've got from birth vitamin D3 all the way through. And then when a baby starts eating or interested in solid foods, say 6, 7 months, that's when we can look at the other supplementation that we can do at that point and add into the baby's diet. So at that time, really the most important thing, the next important thing to think about adding in is the omega-3 fatty acid, DHA. So DHA is the omega-3 fatty acid most commonly found and prevalently found in fish oils. So as long as the fish oil is very clean, as long as it's been certified, as long as it's been tested, then we add in the DHA, ideally at that time. Why do we do that? The brain is the fastest growing organ in those first 7 years. We have a saying about how the first 7 years are the most important, most critical for every child. And why a big part of that is that by the age of 7, the child's brain is 95% the size of a fully grown adult. So in 7 years, the child has grown their most important organ to the size that it can, and that's pretty much what we'll be working with for the rest of our life. But for what we're exposed to, both as adults and children in the external environment, in terms of the metals, plastics, pesticides, chemicals, that's where we all can use the antioxidants. So vitamin C, number 1, vitamin A, vitamin E, those are the 3 primary vitamin antioxidants, and then zinc and selenium are the 2 primary mineral antioxidants.
There are a lot of things in the environment that are in contact with our children's immune system today that children years ago haven't faced. So it's really important to keep that in mind, that maybe the food that they're eating today isn't as nutritious as the food we were eating growing up, or perhaps when they're at school they're not eating what they should be. So it's really important to think about those factors, and it can be an easy switch to start incorporating dietary supplements into whatever meals you make at home and make it a habit for the whole family.
We have what's sort of called a core four for any parent to think about for their child. So a good multivitamin mineral that covers that part, the DHA, which covers the omega-3 part for the brain especially, the vitamin C for the antioxidant, environmental protection, vitamin D3 just because so critical for everything. Almost every organ system in our body has vitamin D receptors, so it's like the sunshine vitamin that the body functions on. And then the additional one, and the one that we add in to make all of that work together, are the probiotics, so that the gut is the healthy foundation at the bottom of it all. So as parents, if we look at it in terms of, building a healthy toolbox right from the very start, let's start number one with the home environment. We make that as clean as possible. Remove all chemicals, anything that's not natural from inside the home. Number two, we look at the cleanest diet we can provide our children. So the healthiest diet, cleanest diet, organic foods. Then number three, we're looking at how do we supplement properly to help them overcome any deficiencies, but also protect them from that environmental burden that we've been talking about. That's, if we really can build that toolbox from the start, then the child is being sort of supported all the way through and is not only getting everything they need to grow to their genetic potential, but also protecting them from any adverse environmental effects. And by starting these habits, from the healthy toolbox right from the very start, then what we're doing is creating a sort of lifetime of health habit for our children. So we're laying down the foundation, we're giving them what their bodies need to grow up and then develop in this world, and the chances are that they will continue to do the same habits as they go into adulthood as well. So we're really building something from the beginning that carries them not just through this most important 7 years, the first 7 years, but for the rest of their life.